Evening, everyone. It's a pleasure to welcome you to our public awareness program, Expert Talk on Viral Hepatitis. Our aim is to provide top notch education and awareness programs for healthcare professionals, patients, and their families. Today, we are honored to have Dr. Ronak Ajmera, a distinguished gastroenterologist from Mumbai, as our guest speaker. With over 10 years of experience in the field, Sir is renowned for his exceptional care and expertise in treating various gastrointestinal and liver disorders. His commitment to patient centered care and spreading awareness about viral hepatitis is truly commendable. Sir's vast experience and clinical skills have made him trusted healthcare provider in Mumbai. We are grateful for his dedication to improving liver health and educating other important uh, topic. So, without further ado, I would like to invite Dr. Ronak to share his valuable insights on viral hepatitis with us. Over to you, sir.
Okay, thank you. Good evening to one and all. Um, Thank you for this opportunity. Today, let us discuss about viral hepatitis, that is inflammation of the liver due to viral infection. So first, I'll just uh, briefly present one small presentation. It's just about 5 to 10 minutes, and then mostly I would like that we will have questions and answers from audience, our general population. Any questions or any myths or anything they want to know about, not only about viral hepatitis, anything related to, let's say, liver today. So let me just share the presentation. There are only 5 to 6 slides. So let me just share that to set the ball rolling. Hello, hello.
Yes, sir. Yes, sir.
Yeah, I am audible, right? Okay.
Yeah, you are audible, sir.
So
You
I'll
can.
share the screen now. Okay, so can you see the screen?
Yeah, go to slideshow mode. Yeah, perfectly coming.
Fine. Okay. Okay. So I'm Dr. Ronak Ajmera. I am a medical gastroenterologist practicing at Borivali at Aryan Hospital. Uh, World Liver Day was on 19th April. What is hepatitis? So hepatitis means inflammation of the liver. As the name suggests, hepatic means liver, hepa means liver in Greek, and itis means inflammation. Itis of any organ followed by itis is inflammation. Means hepatitis means inflammation of the liver. Appendicitis means inflammation of the appendix. Colitis means inflammation of the colon or large intestine, and so on. So viral hepatitis means there is a specific virus which causes inflammation of the liver and damage to the liver. So coming to causes of hepatitis in general, the causes can be divided into acute. Acute means recent, means अगर किसी को सडन बीमारी होती है विद इन लेट्स से विद इन 1 month, विद इन 4 weeks, having new symptoms like fatigue, fever, jaundice, then those things can be attributed as an acute illness. And if somebody has symptoms for a longer time, let's say 3 to 6 months or more years, then those the disease is due to this disease is called as chronic. So these are just simple medical words, but nowadays laymen also might be, most of them may be aware about these words, as they are very commonly used. And the causes are different, and the treatment and the approach will be different if the any illness or disease is acute or chronic. So these causes of acute hepatitis are due to viral infection, that is viral hepatitis, any non-viral infection, that is alcohol related or drugs related, drug induced, any medication induced, like overdose of um, paracetamol, or any Ayurvedic overdose of any over the counter health supplement, or weight reduction supplement, or Ayurvedic drugs which may not be approved but available over the counter. Uh, Other common cause is metabolic disease, but which generally causes chronic hepatitis. Now, coming to chronic hepatitis, means the inflammation is there since a long time. So, in this case, patients may or may not have any symptoms, and the causes again could be due to viral infection like hepatitis B and C. Alcohol can be due to some drugs also, some anti-epileptic drugs or any drugs which are used for any cardiac patients. Non-alcoholic steatohepatitis, that is if the patient is having, that is called as metabolic disease, like if the patient is having uh, uh, long-standing diabetes, high cholesterol, um, obesity, then these patients may have fat deposition in the liver, and that can cause slow and chronic damage to the liver and causing chronic hepatitis, which may be asymptomatic, means without any symptoms. And other some rare causes are autoimmune hepatitis. So coming to viral hepatitis, there are five viruses. They are named A, B, C, D, E, as and how they were discovered by in science. So any of these five virus can infect the liver and can cause damage to the liver. That is viral hepatitis. So out of them, hepatitis A and B are vaccine preventable. This slide is most important, that uh, about the viral hepatitis for for the general population, that if somebody has hepatitis, viral hepatitis, in that this hepatitis A and E, they are foodborne disease. So uh, one can that virus can be spread from one person to another person by fecal-oral route, or by sharing the food, or by if the food is contaminated, then it can be transmitted. So it can be seen in epidemic. It can be seen if there is any household contact also, and they are spread. The most important thing is that they are spread by fecal-oral route. So by if somebody is living, somebody is infected, then he has chance of spreading to his family members by from sharing food, where the if from saliva it can be infected, or from contact of feces or stools it can be infected. And hepatitis A and E are acute hepatitis, means the disease will be the patients will have symptoms, acute symptoms, like patient will first have fever, fever, vomiting, loss of appetite, malaise, fatigue, followed by there will be appearance of jaundice. That is most commonly noticed by general population. So jaundice is yellowish of eye, means आंख पीला हो जाना, जो हम पीलिया बोलते हैं या काविड बोलते हैं, या यूरिन येलो हो जाता है. So when jaundice appears, the most of the time patients seek medical attention, and in these cases, in cases of viral hepatitis A and E, and then they are evaluated by blood reports, and by which the qualified doctor confirms that it is viral hepatitis A and E. They are these hepatic illness, viral hepatitis A and E, are self-limiting 99% of the time. So nothing to worry. jaundice may be there for 1 or 2 months, but patients will be asymptomatic. Patients can do their routine work. Um, it's just that they may have yellowish jaundice, that is yellowness of the eyes and urine, but otherwise they don't have any other symptoms. They can carry out their work, of course, once they get clearance from the qualified treating doctor. Uh, Hepatitis B and C is they are chronic hepatitis, means if the patient gets infected with this virus, then that virus will be there for a long time in patient's body unless we keep it suppressed by medications. So for that, uh, for these patients are generally detected incidentally when they go for blood reports, routine examination, routine blood reports for their maybe insurance, or if they are going abroad, or if they want to undergo some surgery, like elective surgery like cataract surgery or hernia surgery, etc. And incidentally, they find that in blood this virus test is positive, and then they are referred to gastroenterologist, hepatologist, then that what to do. And in this today's date, nothing to worry for any of these hepatitis because they all can be easily controlled, provided we take appropriate guidance from the doctor and medication. So for hepatitis A and D, I told that they are acute and they are self-limiting. They will the body will take care of those viruses uh, by himself. But hepatitis B and C, the one may have to take medication, and that medication dose for duration, when to give, how to monitor, those all can be advised by qualified gastroenterologist or hepatologist physicians. But the bottom line is that not if somebody is detected, then not to worry, take appropriate guidance. Other one more thing about hepatitis B is that we all should take vaccine if not taken. आज के ज़माने में most of the people born maybe after 1980s, 1985, they are vaccinated. It's because hepatitis B vaccine is given since birth. So once we take the so from people born after 1980, most of them must have taken hepatitis B course once they were born at that time in the hospital, including the government hospitals. So uh, there may be some rare exception. So if one is not sure, then one can check the antibody titer, and then if the titer is low, that means there is the no protection against hepatitis B. Then one can take the vaccine again. The vaccine is very simple to take. And if somebody is not sure about anything and one has to take the vaccine, they can take the vaccine if the hepatitis B is negative. Uh, Secondly, that hepatitis B and C, if someone is infected, then he or she should take care that it doesn't spread to their uh, nearby people by contact of blood or sexual contact. So, um, let me tell you that hepatitis B and C is spread by blood. The virus is present in the blood and body fluids, not saliva, but body fluids like blood, uh, semen, and vaginal fluids. So, um, if somebody has hepatitis B and he or she shares, uh, let's say, razors, or if uh, the blood of a patient comes in contact with another person who has cut on his skin, then there are chances that the other person may get infected. But at the same time, if somebody is already vaccinated, then the chances of getting hepatitis B and C almost becomes negligible or zero. So that's the importance of vaccination for hepatitis B. And hepatitis C is easily curable in today's date because wonderful drugs are available which can cure the virus from the body totally. So another mode of transmission of hepatitis B and C is tattooing. If the tattooing means tattooing, if the because in that the needles are used. So if injection drug users are there who share the needles, or if somebody uh, uses the same needle for tattooing, if the needle is used from a person who is infected with hepatitis B and the same needle is used for other person, then there are high chances that this other person may get infected with hepatitis B and C, B or C, whatever. Hepatitis D is a rare viral infection and it occurs always in combination with hepatitis B. So let's not go into that. So this was just general about viral hepatitis. So if the liver gets infected by hepatitis B or C, which causes chronic hepatitis, means long-standing, unnoticed, asymptomatic infection, which goes for a which is there in the body for a very long time and which is incidentally detected on routine blood checkup or done for some other reason. And if the person is detected and if they are treated appropriately, then it can be controlled and then there is no worry. But if it is unnoticed, then it can cause cirrhosis. That is, it can damage the liver irreversibly. And in this, at this stage, the symptoms may appear. And once these symptoms appear, then the damage done to the liver cannot be reversed, in spite the person takes the medicines for hepatitis B or C. So it is very important to uh, see that if a person is detected with hepatitis B or C, he is treated properly, he is followed up properly, he takes medicines, he is compliant to the medicines, he doesn't forget to take medicine or doesn't forget follow up, because sometimes we see that patients are advised medicines but then they go to their hometown village and then they forgot the doctor, they forgot the illness as it is asymptomatic, and then after 5 years they suddenly come up with end stage liver disease with symptoms, that is cirrhosis. So that is important. And also if a person is detected with hepatitis B, then we should screen his first degree family relatives with for hepatitis B or C, as there are chances that they also might be affected. As I told that it is transmitted by blood or sexual relations. So hepatitis B or C can be transmitted from mother or father to the child, or from husband to wife or wife to husband, vice versa. So at least the first degree family relatives should be screened. If so, and if we can detect them in asymptomatic stage, then we can prevent their damage to to their liver and progression to end stage disease like cirrhosis, and which can develop into liver cancer, that is HCC also. So to summarize about the viral hepatitis, hepatitis means inflammation of the liver. Major and common cause of hepatitis, both acute and chronic, are alcohol, viral infection, which we discussed in brief, and non-alcoholic state of hepatitis, that is metabolic syndrome, which is related to diabetes, hypercholesterol, blood pressure, obesity. Five major types of viral hepatitis is A, B, C, D is not common, and E. Hepatitis A and E cause only acute infection. Hepatitis B, C, and D cause acute infection, but when these viruses are not eliminated by body's immune system, they become chronic infection. Hepatitis B, C, and D, when not treated, can lead to chronic disease, infect fibrosis, and cirrhosis, that is the end stage liver disease, where the liver is totally fibrosed due to repeated inflammation followed by fibrosis. So that can cause permanent damage. So thank you. I will now stop sharing my screen. Hello.
Yes, sir. Thank you, sir, for this wonderful talk. This has enlightened us. Now, with your permission, I would like to ask few questions from you, sir.
Yes. Yeah.
Uh, Sir, can viral hepatitis lead to long-term health complications?
Yes, hepatitis B and C, as I told, if somebody is detected or if anyone in their family are detected to have hepatitis B or C, then it can cause long-term uh, uh, asymptomatic liver damage unnoticed, which can progress to liver cirrhosis
Okay, sir.
if not treated properly.
And how can viral hepatitis be prevented?
So hepatitis A and E can be prevented by avoiding eating at um, unhealthy places. Nowadays everybody, many of us eat roadside food and all, so because it is transmitted by fecal oral route. So as I told, so अगर कोई अनहाइजीनिक प्लेस पे कोई कोई फूड लेते हैं हम, और अगर वो प्लेस पे जो भी वाटर या यूज होता है उसमें वायरस है, तो हेपेटाइटिस ए और ई किसी को भी हो सकता है। तो हेपेटाइटिस ए और ई प्रिवेंट करने के लिए ये ध्यान रखना चाहिए, तो ये बहुत कॉमन सेंस की बात है। और इसीलिए हेपेटाइटिस ए और ई कई बार एपिडेमिक्स में देखा जाता है, मीन्स हॉस्टल में बहुत लोगों को हो गया बिकॉज ऑफ डर्टी वाटर, इधर वाटर इज इन्फेक्टेड, एक्सेट्रा। समटाइम्स इट इज सीन लाइक दैट। And so this is the prevention for hepatitis A and E, which is very important for general population. Hepatitis B and C, for B, we have vaccine for prevention, which everybody should take, especially healthcare workers and paramedical workers, everybody who is working in a hospital, non-medical staff also, or everybody related to healthcare profession who are exposed to body fluids or body tissues, they should be vaccinated with hepatitis B, so that even if they get exposed, they may not get that chronic hepatitis B, and it will be the chronic infection and chronic damage will be prevented. हेपेटाइटिस सी के लिए कोई वैक्सीन नहीं है, बट हेपेटाइटिस सी अगर किसी को डिटेक्ट होता है, अगर किसी को रिस्क हुआ है कोई एक्सपोजर का, देन इट इज इजी टू ट्रीट, इट इज नथिंग टू वरी, वन शुड जस्ट कंसल्ट अप्रोप्रिएटली एंड टेक medications if required.
Okay, sir. And sir, what are the early symptoms of viral hepatitis?
So hepatitis A and E will present as acute illness, like with like first patients may have non-specific symptoms like fever, fatigue, malaise, vomiting, loss of appetite, some abdominal pain, discomfort, especially on the right side where liver is. And then patients may have jaundice, yellow eyes and yellow urine. Uh, Hepatitis B and C may be asymptomatic, just incidentally detected. But if somebody develops acute hepatitis B, especially, then they may have same symptoms which I told. कि fever, fatigue आएगा, jaundice भी हो सकता है. But in these cases, there are likelihood that hepatitis B will be self-limited.
Okay, sir. And sir, can hepatitis B and C be transmitted together, like simultaneously as a co-infection?
It can be, though it is not that common, but दोनों का ही the mode of transmission is same, that is by contact of body fluids like blood or by vertical transmission like from parents to children or sexual transmission. So both of them are if अगर किसी को किसी के मदर को हेपेटाइटिस बी दोनों है तो उसके चिल्ड्रन को दोनों ही आने के चांस है, तो रेयर है दोनों ही एक ही पेशेंट में बोथ डिजीज हैविंग इज स्लाइटली अनकॉमन, बट cases are there. Theoretically also it is possible that both can be transmitted together.
Okay, sir. And sir, NASH is also increasing commonly nowadays. So
Hmm.
just wanted to know from you, like, what is NASH and how do you typically diagnose NAFLD and NASH in your practice?
Okay, so uh, NASH is by full form is non-alcoholic fatty liver disease, fatty liver, non-alcoholic steatohepatitis. In layman terms, अगर किसी को फैटी लीवर सोनोग्राफी में आता है, हाँ, बहुत सारे पेशेंट्स फैटी लीवर का रिपोर्ट लेके आए, सोनोग्राफी में फैटी लीवर आया है, वो देख के फिर डॉक्टर के पास जाते हैं या गूगल सर्च करते हैं। अ, तो उनको सोनोग्राफी कोई और रीजन से किया गया होता है, लेट्स से फॉर फॉर ज्वाइनिंग अ जॉब और फॉर गोइंग अब्रॉड और फॉर एनी अदर रीजन, फॉर इंश्योरेंस पर्पस, फॉर रूटीन हेल्थ चेकअप। फैटी लीवर आया है किसी को, तो दैट मीन्स दैट दैट पेशेंट हैज फैट इन द लीवर, लीवर में फैट है, और वो फैट पेशेंट को इन्फ्लेमेशन डैमेज कर रहा है कि नहीं लीवर के अंदर, वो हमें पता चलता है लिवर ब्लड रिपोर्ट से, दैट इज कॉल्ड एज LFT। एंड वी LFT एल्ब्यूमिन, तो वो ब्लड रिपोर्ट से हमें आइडिया आता है। अब ये जो फैट है वो क्यों आया है, उसका रिस्क फैक्टर्स क्या है, उसको हमको ट्रीट करना है, तो फिर वो फैट निकल जाएगा। उसका कॉमन रिस्क फैक्टर्स है अल्कोहल, ओबेसिटी, डायबिटीज, हाई कोलेस्ट्रॉल, हाई ब्लड प्रेशर। तो अगर पेशेंट्स को इस इन इन पांच में से कोई भी एक है, या फिर एक से ज्यादा रिस्क फैक्टर्स है, तो वो सारे ही रिस्क फैक्टर्स को उसको कंट्रोल में रखना है, ताकि वो फैट जो है वो लीवर में से कम हो जाए। और वो फैट अगर अभी नहीं बट फ्यूचर में अगर लीवर को डैमेज करना होगा, तो अगर फैट नहीं रहेगा तो लीवर को डैमेज आगे नहीं करेगा। एंड दिस डिजीज विच इज नॉन अल्कोहलिक स्टीatohepatitis और फैटी लिवर डिजीज इज नथिंग बट इट इज अगेन अ क्रोनिक डिजीज, मीन्स लाइफ लॉन्ग टाइप डिजीज है। अगर वो फैट आज नहीं तो कल लीवर को धीरे धीरे अगर डैमेज करता है, वो हमको ब्लड रिपोर्ट से ही पता चलेगा, क्योंकि पेशेंट को कोई सिम्टम्स नहीं होंगे। और फिर वो डैमेज करके फिर अगेन जब भी डैमेज करता है तभी इन्फ्लेमेशन करता है, और इन्फ्लेमेशन से बॉडी हील करता है फाइब्रोसिस से। तो इन्फ्लेमेशन फाइब्रोसिस अगेन इन्फ्लेमेशन फाइब्रोसिस, ये साइकिल रिपीट होके पेशेंट को एंड स्टेज लिवर डैमेज फाइब्रोसिस हो सकता है, जिसको हम सिरोसिस बोलते हैं। तो दिस इज नाउ वन ऑफ द लीडिंग कॉज ऑफ सिरोसिस, fatty liver disease. And the risk factors which I told, which I'll repeat again, is alcohol, obesity, hypertension, diabetes, and high cholesterol. तो ये रिस्क फैक्टर्स को अगर हम कंट्रोल में रखेंगे बाय डाइट, लाइफस्टाइल्स एंड medications whenever required, then the fatty liver disease will not progress, that fat will get reduced from the liver, और वो फैट डैमेज नहीं करेगा लीवर को। तो ये बहुत ज़रूरी है फैटी लीवर के लिए, उसके रिस्क फैक्टर्स कंट्रोल करना बहुत ज़रूरी है। फैटी लीवर के लिए ऐसे जो मेडिसिन अवेलेबल है वो भी इम्पोर्टेंट है, बट वो मेडिसिन के साथ साथ कुछ मेडिसिन है अवेलेबल, बट वो मेडिसिन के साथ साथ ये जो रिस्क फैक्टर्स है उसको डाइट, लाइफस्टाइल और रिस्क फैक्टर्स के मेडिकेशंस के साथ कंट्रोल करना ज़्यादा ज़रूरी है, दैट इज मोर इम्पोर्टेंट।
Okay, sir. Thank you, sir. And on behalf of Snash 24 into 7. I extend my sincere thanks to Dr. Ronak sir for his enlightening and engaging talk on viral hepatitis. Sir's insights have highlighted the critical need for increased awareness about viral hepatitis, liver health, and related conditions. I also wanted to express my appreciation to our viewers for tuning in to our Facebook Live program and educational initiatives. Please stay connected with Nash 24 into 7 on Facebook for updates and information on upcoming events. Remember, your health and the health of your loved ones are paramount. Take care and stay well. Thank you, sir, and thank you for joining us.
Okay, thank you. Thank you everyone for joining. Have a nice evening. Thank you.